Today I will be talking about acute liver failure. Acute liver failure is a very serious condition and it occurs due to development of jaundice and altered sensorium in a patient who has liver injury. All patients of acute liver failure should be admitted in an ICU and preferably in a hospital which has facility of liver transplant. This is the recent standard of care for all patients of acute liver failure. Now we have to understand, why does acute liver failure occur? There are few very important causes of acute liver failure. So in India, if we see hepatitis A and hepatitis E and hepatitis B infections, these are the infections which can cause acute liver failure. Hepatitis A and E are transmitted by eating contaminated food and drinking contaminated water. Hepatitis B is transmitted by either sexual route or through contaminated needles or infected blood. Then the other causes of acute liver failure include drugs, and in our country where anti-tubercular therapy is given for tuberculosis is known to cause acute liver failure. Along with in the West, however, paracetamol is one of the most important cause of drug-induced acute liver failure. Then if we come to the other causes, there are rare causes like autoimmune hepatitis which can cause liver failure. In children, if we see, Wilson disease and autoimmune hepatitis are one of the main causes of liver failure in young children. So now, once a patient of acute liver failure is admitted with us, we evaluate all these causes. Now treatment is very crucial at the right stage. We need to give supportive care to these patients in form of IV antibiotics, IV fluids. We need to keep them in ICU with us. Then we start some specific treatment to the etiology. Like if the patient has hepatitis B induced liver failure, then we start treatment of hepatitis B with potent antiviral drugs. Hepatitis A and E need supportive treatment, and we also give N-acetylcysteine to all patients of liver failure as it is known to be liver protective. Patients who have autoimmune hepatitis or Wilson disease need specific treatment with either steroids for autoimmune hepatitis and specific drugs for Wilson disease. The most important factor determining outcome is how the liver recovers. If at any point there are specific criteria where we feel that the liver injury is too much and the patient is not improving, an option of liver transplant is given to all the family members. So 50% to 60% of patients do recover, but another 30 to 40% do not recover and they need a liver transplant to avoid a fatal outcome. So acute liver failure is a serious condition. We need to admit patient in ICU. Proper treatment care is very important, and a hospital with backup of liver transplant is a must in all patients admitted with acute liver failure.